Well, friends, welcome to today's webinar. And today we have with us Dr. Swaminathan. He'll be from Kerala, and he'll be speaking on competency-based medical education. Over to you, Dr. Swaminathan. I think the name of your college is slightly cryptic for me.
Yeah.
So can you just...
No problem. I'll introduce myself.
Yes.
Hello, friends. This is Dr. Swaminathan. I'm Professor of Pathology, Tirunelveli Medical College. It is in Tamil Nadu, the southern tip of our country. And I thank Bedit sir profusely for including me in this team. So we all know about competency-based medical education, and the phase one, the students have already rolled in, and these students, they will come to us in phase two.
I think hello, Dr. Swaminathan.
Yes,
I think I'll have to restart because I forgot to press the start button. Well, friends, welcome to today's webinar. And today we have with us Dr. Swaminathan from Tamil Nadu. He will be speaking on competency-based medical education in pathology. What is new? Over to you, Dr. Swaminathan.
Thank you, Bedi sir, for this wonderful opportunity. Hi, friends. I'm Dr. Swaminathan, Professor of Pathology, Tirunelveli Medical College, which is located in Tamil Nadu. And I'd like to share some of the views on the new MCA curriculum on competency-based education. So we already know the students have been enrolled last year in the first year, and after their exams, they'll be landing into phase 2 subjects. So as faculty of phase 2 subjects, we have to know what is new in the curriculum which has been given by the Medical Council of India. So my short presentation will be the summary of the booklet which was given to us on the competencies of our individual specialties. So what is new in this? So basically it is an outcome based, as all of us know, all of us have been trained in medical education. We know it is an outcome based approach, and there is a lot of change in the design, in the implementation, in the assessment and evaluation. And we do all this with an organized framework of competencies given by the medical council. So basically we have to have these salient outcome based. It is learner centered, and the main future of this program is the pattern of assessment. The assessment should be in a form of formative one. It must be continuous, and it must be criteria and reference. So these are the salient areas where emphasis has to be given in this new form of curriculum. Okay, what is new? The first one is which troubles most of us is the study period has been reduced to 1 year. So we were comfortable with this 1.5 year course, but now it has been tailored to 1 year, and the total number of topics to be covered, the main topics are 36, and the competencies which the Medical Council of India gives us, or it enlists, are 182. And the same document, it also gives us a number of topics which can be used for integration and alignment. I'm sure all of us are well versed with the term of integration and in the form of alignment. And other most very important part of the document is there are 3 important skills in pathology training which we have to certify, which we are not doing in the previous thing. What are those 3 skills? The first skill is preparation of a peripheral smear and interpretation of an abnormal smear. This is a very important skill where the students have to be trained technically in the preparation of a peripheral smear, staining and proper reading of a peripheral smear and reporting of a peripheral smear, both normal and abnormal. The second skill which has to be certified is interpretation of a liver chemistry test. Of course, we no longer use liver function test. We call them as liver chemistry test, and the student must be well versed with reading the normal report of liver chemistry and an abnormal report of liver chemistry, and to correlate with the findings. The third skill which we have to certify is the CSF analysis. Student must have the skill or must be trained to have the skill to read a normal CSF analysis and an abnormal analysis and give his interpretation on what. So these are the main things. So we have got main topics to be covered, which include the 36 topics, 36 main subject headings, and we have to cover 182 competencies and 3 important certified. Okay, any discussion now? We'd like to have your views until now. Hello. Hope you are with me. And shall I proceed? Bedi sir. Hello. Shall I proceed? Hello. 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 So the total competencies, as I told you, are 182, of which we classify them into 2 areas. One is core competency and non-core competency areas. Core competency means mostly the must-know areas. The non-core means desirable or nice to know areas. Okay. Having known the total number of competencies, at to what level we have to teach the students, or we have to make the students learn. So certain competencies like the history of pathology, history of certain developments, they are up to the nose level. That is, there are 5 competencies which we have to train the students up to the nose level, and majority of them, like 152, they come under the knows how category, where we have to explain the reasons behind the concepts. Then comes the shows how, where we mostly comes in the demonstration or practicals, where there are 25 competencies. And as I already told you, for the certification or at the performance level, we have 3 competencies. One is doing a peripheral smear and reading a peripheral smear, reading an abnormal liver chemistry test, and reading an abnormal CSF analysis. This is in short the summary which is given in the MCI document. Any views?
Yes. There are some hands.
Yes,
Dr.
sir.
Vijayshri.
Yes, sir, please.
Dr. Vijayshri has raised her hands. Yes.
Yes, sir. Good evening, sir.
Yes, madam.
Thank you
Yes.
for this particular CBME inputs. I have a doubt. Are these 3 skill-based
Yes, ma'am.
competencies are to be
Yes.
certified or just to be performed? Because under UG, there are no certification competencies as far as I know.
No, MCI document, the first volume of the MCI, it clearly states, ma'am, there are these 3 have to be certified. They clearly mentioned it. Only these are the 3 skills which we have to certify that they are have the level of competence to do this. It's there in the document. You can refer it, ma'am. At the
Okay.
end, you can refer it. It's there in the document.
Yes,
Yes.
certification is one important difference between earlier and now.
Yes, 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 sir.
Yeah.
It was not there earlier. Earlier, we didn't have any certification. They just do the skill and we give a score for the skill. That's it. In the practicals, we give a score, but now it comes as a certified skill. MC calls it. Only these three topics.
Okay. Okay. Thank
Okay.
Dr. Tejas,
Good evening, sir. Sir, I want to ask that in you said there is a total number of topics is 36
Yes, sir.
and total number of topics for integration and alignment is 243. That I can't understand.
No, lot of overlaps is there in the topics for the integration. Lot of topics are overlapped because nephrotic syndrome, it's discussed with physiology also. It comes with pediatrics also. So there's a lot of overlap which we could plan.
Okay. So for
Yeah.
pathology is 36.
Yeah, it's just the thing. It's a gist of or a summary of what the MCA document says. Sir. It's the 34 pages
Sir.
into one. That's it.
Okay.
The lot of overlaps is
Okay.
there. It's up to us to plan and do it.
Yeah, definitely, sir. Okay, sir. I understand. Thank you, sir. Yeah.
Okay.
Okay.
Shall I go?
Yes, sir.
yes, there's Dr. Kalpana also. Doctor.
Yes,
No,
sir.
sir. Thank you.
Yes, Dr. Kalpana.
Can I?
Yes, please
Yes,
continue.
sir.
Hello.
Yes. You raise your hands. You want to ask a question, Dr. Kalpana?
Yes, sir.
Yes, please ask.
In the for the liver function test, only the chemistry is required, or the interpretation of the various diseases, hepatic diseases in relation to the liver function test is to be certified.
Is interpretation of various diseases. Actually, we have to make. Actually, we have to sit down and make a list of the conditions which we expect an undergraduate to know at the end of his training period. Like he has to know the to differentiate between the various types of jaundice, or to pick up an early liver failure. So whatever we think is essential for the student, we have to make a list first, the list of conditions.
Yes.
Then we have to make a chart which
Yeah.
is suitable to that condition, train him in
Yes.
that particular area. Which
Yes,
we
sir.
think as an undergraduate, when he comes out, what skill he has to need, that we have to make a list, ma'am. Particularly, according to me, the different types of jaundice we can have, or portal
Yes.
hypertension, whatever the chemistry of portal hypertension or chemistry of acetic fluid. So whatever we think, we will make a list. Actually, we can work as a group and we will formulate the list of topics which could be appropriate, which could be tailor made so that it is uniform throughout.
Thank you, sir. Thank you so much.
It's up to us to decide. Yes. Shall I proceed? So
Yes.
having known the various all the number jargons and the level of competencies, now we'll see how to achieve them. What methodologies we have with us. As usual, we are in faculty education institution, we have to do with lectures, and if possible, we can engage the postgraduate residents to conduct small group discussion, particularly for competencies which are at lower level. We can use the small group discussion, and we can also use this demonstration, observe, assist, and perform for the skills which he actually does in the practical examination. But much more important thing where we have to put our brains down is the assessment. And I've told you the key of success of CBME is the assessment. And we are all have a single thought that continuous formative assessment is the answer for it. So why formative? Because we know it is process oriented. How learning is, it clearly indicates how learning is going. It is reflective. It is flexible. It adjusts as the problems are clarified, and it is cooperative. And much more, the very important one is it provides feedback to the students on the strengths and weaknesses, and it is remedial. So it has got a lot of positive input which we could use to the maximum limit. And what advantages do we have by doing this continuous formative assessment? Because they are the early indicators of the student performance. It helps the students themselves to get motivated how to recorrect themselves, and there's a scope for continuous improvement, and it can test those. The last one is very, I think, is very important. It will test those competencies which cannot be tested by a summative. We can include them in the formative so that he gets it a due attention as he undergoes the training process. But problems we have still, it's not such a thing. We do have a lot of issues with the continuous formative assessment, and it is not, as we all know, it's not completely used the full potential. And normally what we conduct as a formative assessment is an internal examination, which is a replica of the summative one. The more emphasis is given to theoretical aspects. Practicals and skills are not given that much weightage, and there is no uniformity in the conduct of these sessions. And faculty training again is much as Vedisar is trying now. Faculty training is very essential, and the variability of the markings. Okay, so having said that, we have to do a continuous formative assessment. How am I going to do? As usual, we can have short written examinations, which could be purely based on short answer questions, multiple choice, or you can have essay questions. We can have assessment of the practical skills, or we can conduct structured viva voce on predetermined questions by the examiners. And weightage can be given to these areas which we didn't do until now. Classroom participation, how the student performs in class, weightage to be given. Group discussion, how he participates, how active he is there in group discussion we can do. We can conduct quiz, marks can be taken from the quiz, or some small student conducted seminars can be done, and we could see how they do. Or we could also judge them from the performance in the tutorials if we conduct them. And for certain problems which are clinical oriented, we can have clinical case presentations. Weightage can be given to assignments. It could be a group assignment like a small project, or an individual assignment. We can have weightage for short-term projects, reflective writing, portfolio, and the skill could be assessed as we do for the OSCE. We can do by DOPS, particularly for peripheral smear examination. As we have the DOPS for the clinical skills, we can also have DOPS for doing a peripheral smear and how he does the interpretation of a peripheral smear. We can also we can modify the checklist slightly, and we could develop our own DOPS for these skills which have to be set, so that student he does the procedure and he becomes a master, because we have to certify that he is skillful in doing the thing. So repeated thing has to come out by doing this DOPS. And as the role of online, now we are so comfortable with this online webinar and online e-learning and assessment has become a part of all the curriculum. We could use this online platform also, because again the problem of time, we don't have time to do all this. So the problem comes, when I'm going to do this, how I'm going to. We can use a portion for this online discussion. Particularly, we can use Google Classroom. It's an excellent tool. We have tried in our institution for a small batch of classes, where we could post some triggers, make the student to respond to the triggers, and evaluation can be done based on the responses. We could do a web-based assessment, or if you are fine enough, we could use platform like Kahoot, or you can have self-assessment online quiz. All this, it's up to us. So we have a lot of tools which we could tailor to the students of our college, which is suitable we could use. And according to me, Google Classroom, which I have got some experience with Google Classroom, and it works really well in the form of. So if we could use particularly the Google Classroom for areas or certain or nice to know areas or for desirable to know areas, we could use this Google Classroom. So it saves a lot of time because it is done not in the class hours, it's done outside the class hours, and students are at the liberty to approach the web and they give you the answer. So it's again, there is an active self-directed learning happening in this online pattern of class. Basically, because student has to take real interest, he takes it or he comes back to the faculty, he gets, where do I search the resources? He go back to the library, he finds out the answer, then he puts up in the Google thing. So it makes the entire process very active and self-directed. The medical center of India, it wants a huge chunk of this because it's humanly not possible to cover the entire topic which is given by all the competencies within that 1 year study period. So they have to plan. Every institution have to have their mini plan where they are, what topics will be taken in the classrooms and what topics will be done as a self-directed learning. Then if so, what is the methodology of the self-directed learning, and how it is going to be, because assessment again is very important thing. Assessment should come along with the learning. So how are they going to, whenever we plan any online, any new online programs, again think how we are going to assess it, how we are going to assess the student performance has to be planned meticulously. A student has to be told priorly that this is your online thing and this is your way we are going to assess you. So students will also be very clear that how they are going to be assessed. We use this online
Yes.
for the time constraint. We all know
Dr. Suparna
advantages.
Sir, I would like to ask two questions. One is that most of the colleges now have a batch of 150, 200 or thereabouts. How can you assess the classroom interaction? I mean, some students are forthcoming. So how do you mark that? Because maybe 5, 6 students at a time might interact. So what is
Dr. Suparna, that is the challenge. And I think during these sessions, as he said that we will be, there are electronic methods, there are some other methods by which we have to assess all the 100, 200, 250 students. Everyone has to be assessed.
another doubt that I had was regarding like Google Classroom. So any assessment will also be included in those hours which are specified for pathology. So are these, since Dr. Swaminathan has some experience with Google Classroom, are they including those hours also in the teaching hours or are they not included? And what about those students? What about the attendance for this time? And what about those students who are not participating? How is that part like teaching hours vis-a-vis teaching hours? How is it working out?
Google Classroom doesn't come in the class hours, ma'am. It's purely the extra classes because we cannot include that also in the class hour, which they will not be able to.
Okay. So it is like it depends on the student's level of motivation, basically.
Instantly you give. Okay.
We will have to make that compulsory.
So you just like a trigger,
Thank you, sir.
And it just first 50 responses will carry 2 marks. Something for what it's up to the department to decide. So we can't have a uniform score for the thing. Something like that. First 50 responses will have this score. Second 50, something like that. We can, so it makes the students, because they're very young and energetic students who are tech savvy also. So they know they know more than us in the online thing. So they will definitely.
Sometimes in some of the workshops we say our students are digital natives. They know these methods from the mother's womb. I mean, you just give any.
Yeah, that's true.
True, yeah.
And I mean, it's the teachers who are digital migrants. So
they are not. They are not.
Yeah, that is true.
So digital migrants are teaching digital natives. So it's I mean, they will do it, no problem.
They will do it.
Yeah, no, sir, I understand, but I was thinking about the motivation levels, how much they will join in if it is beyond classes. Should we then include it, make it compulsory in the marks profile which we add for the assessment? That is one point that was That I mean, what is sir doing? So I wanted his opinion on that.
Madam, 5 to 10% will be not participating at all, madam. There will be a problem. Suppose I have a batch of 150, around 10 or 20 students will not be active at all. We can slowly make them, because once they see the marks the other students get, once they see that, they become self-motivated, or we could call those students like in the mentor-mentee sessions and find out what is the real difficulty they have.
Yes,
Some people
sir,
will have
that's
difficulty.
true.
Yeah, some people may not have. It happened once. I called the student and asked, and I found that he was not having any Android device. He was having that old cell phone. So he was keeping quiet, didn't participate at all. So then I found out. Then I found out some other way to use the system in the college and make him contribute to that thing. So these problems will be there, ma'am, but we have to slowly address it, find it out and address it, and make, because for want of time we'll be having lot of issues on his.
Dr. Ramani?
Yeah, good evening, Dr. Sanjay. Dr. Swaminathan, I just wanted to put in a word here. Like most of the students,
Thank you, sir.
especially in private medical colleges, I've noticed that they're not very keen on attending all the classes. So if they are getting
Yes, ma'am.
80% attendance, that's it. They're staying back and trying to read either through videos or through the textbook. So how do we
Yes,
motivate? Because this is going to be the biggest trouble for us to motivate all the students. Because private colleges have management quota and NRI quota and all. So I think this is going to be a big issue and task for us. This I just wanted
and
to.
Ma'am, if they are
can be
learning,
That is what I was also trying to ask, because if it's not compulsory, then how can we ensure that they are there?
Yeah,
so it's
yeah,
not
that's what
compulsory,
same
madam.
thing I was thinking.
We
Yeah,
are going,
yeah,
we are going to mark for each participation. He is going to get an incentive. Some sort of allowance is going to get, which is going to, because which is going to be a part of his formative assessment score. So once we say, if you do well a year, you get more scores, it can be motivational. Number two, as my teacher used to say, to teach what is not there in the textbook. To make learning happen,
yeah,
something like that. So we have to make some sort of innovations in our teaching skill to at least to kindle the interest and ask him to do it later. And assessment is in our hand, man. So what you do is you
yeah,
make
yeah,
up a question where he has to
yeah,
like go up to the
yeah,
cognitive ladder to
yeah,
answer it, because
yeah,
some small tricks like I absolutely say that I could easily make a presentation, but it's again practically speaking, it's a real issue for us. But yet at least it's
yeah.
normal thing we could try
Yeah,
it
yeah, we
out.
try,
In
we
the
try. But I
yes,
think we have to loop in the university also, so that these
absolutely,
marks will come under the formative assessment. And then
absolutely, ma'am.
somehow we have to, in the beginning, we have to force the students. Slowly they will
Yeah,
realize and fall into our line.
yeah. Actually, we have to meet the board of studies now for
yes,
the
doctor.
Yes.
this one we found the timetable for the exam, what has to come from where. We have to sit together to make an assessment plan. What has to come, how much weightage has to be given here. We all should sit together, make a plan, and then present it to the concerned universities and get them involved in it, because they are the people who are going to do the assessment. And it's a problem with us when they don't say it properly.
Yeah, exactly. Thank you. Thank you.
Dr. Ingin,
Hello, sir.
Yes, sir.
yes,
Hello, sir. Can you hear me, sir?
Yes, madam.
yes.
Hello.
Yes, madam.
Yes, sir. It's the same thing. I just wanted to know the level of the interest, but I think the most of the things were cleared by the questions asked by other two attendees. This is because all
Okay,
the
doctor.
students are not at the same level
Yeah, that's
of
true, madam.
listening to the
We have
classes.
some plan to bring them into the mainstream.
Yes, yes, sir.
We
Yeah,
have to do.
I mean,
Yeah,
so we have to create certain groups
yeah,
based on
yes,
the assessment. Uh,
yeah,
I mean, they are slow learners, they are fast learners, divide them.
yeah. Sure.
Yes, of course, sir. And I think the feedback which we give to the students will help them to
Together,
come back to learn better.
and the
Yes.
and
I
students
mean,
should have
from
realization.
marks to grades to feedback.
Yes, sir.
Yes, sir.
Dr. Madhusmita Jaina.
Thank you, sir.
Dr. Jaina. Dr. Madhusmita. Then Dr. Tejas Choksi.
Sir, I want to ask, because see all these things, suppose because all the faculty, the one part is also already you have told about the student.
We have the
Then one part is also come for the faculty also.
participation.
Because all faculty, I think, is not trained for this process. So is there any program or anything that faculty?
Sir, that is why we have created this group. That is why we have, we still have 2-3 months to go. This is the
Okay,
second
sir.
webinar.
Okay, sir.
So
Yeah.
we will be going chapter by chapter and discussing these things together. I am also a co-learner. Let me tell you.
Yes, sir.
So many
Yes,
of you
yes.
are knowing more than me. Some are, I mean, so some things I will teach. So it will be togetherness. We are all in the same boat.
Okay, sir. Okay, sir. Thank you, sir. Thank you.
Yes.
Thank you, sir.
Dr. Kalpana.
Hello, good evening, sir.
Good evening.
Hello.
Yes, please.
All the doubts about the formative assessment, they are discussed. And the formative assessment is the most laborious things for the faculty. And the junior faculty has to be trained for conducting the continuous assessment. That is what I think will be a training required for the junior
Feedback
faculty.
is very essential to us. At least we must train
Hello.
our junior faculty at least to have some group, mentality group even.
Yes. And we have to tell them how to do the case discussions, case-based learning, and then how to evaluate them. That is, this training is to be conducted for the junior faculty.
Sir, I
Yes,
had
ma'am.
another question. Sir, I was wondering, like, if there's an assessment every quarter of the year, that is like, will that be like a university exam with externals and all? But it will be very what should I say, labor intensive and also infrastructure intensive. So
This will be internal assessment.
internal. Thank you.
Internal assessment.
Yes.
Thank you.
That means 3 internal assessments and 1 final. It is right now we used to have 2 internal assessments.
Yes. And we had a send up also. So we had 3 internal assessments, but over 1.5 years. So
Yes. So this is now we have 1 year and 3 internal assessments and
Every 3
okay.
months. Every 3 months.
Yes. Yes. Dr. Manjunath, please unmute yourself. Dr. Manjunath, can you please unmute yourself? You are self-muted. You have raised your hands. Yes.
Good evening, sir. Can you hear me, sir?
Yes.
I have a question on regarding the tools of formative assessments. How can we do the simulated this one based assessment for the 150 students, sir?
I think that is a topic for another webinar.
Yes,
Okay,
sir.
okay, sir. Okay. Because,
That's a huge
now
thing.
students
I think we along the way, chapter wise, when we actually create study materials, I mean, because the whole thing, I mean, before October when the thing starts, we have to get certain things ready according to the new plan, and it is a huge task. I mean, it is not possible for one department or one person, or I mean, to do the whole thing. So we will all have to collaborate. So let's see how it goes.
Yes, sir. So then,
Creating lots of cases and simulations. I mean, scenarios. It's a mega task.
yes, sir. That's what I wanted to ask, because we may
Wait,
Yes.
sir.
Yes, Dr. Anshu.
I think, yeah. Yes, madam.
Dr.
About
Anshu, can you? Yes.
am I audible?
Yes.
Yes, madam. Yes, ma'am, you're audible.
Yeah, so when you're saying 150 students, what you can do is create some of this material online, like have
Yes.
a full question bank of MCQs and they shuffle and they count. So maybe the first year you'll have to make a lot of effort. Every year you
Yes.
can keep adding to it, and these things can be keep changing. And for the next year onwards, you won't have so much work to do. So online assessment, you don't have to correct the papers. The feedback can be given directly. So like if I make an MCQ and I'm trying to do it at the moment using Moodle, so when you make a question, so if I suppose I give them a question of what does aspirin do, I can put it in a scenario like a person takes uh, aspirin for a headache, and which of the vessels are going to be what activities are going to be affected, or an inflammation question. And I might give him give the student 4 options, like I say vasodilatation, I say chemotaxis, I say phagocytosis. So I'm asking an applied question, and for each question I will give a feedback there. So if a student clicks the wrong answer also, there is feedback available there saying that this is wrong, so go back and read something else. So this is what you have not understood, so go back and read page number this of your textbook.
Internal assessment.
So you can create that kind of material. Now you have time, so whichever student teacher is taking whichever topic can start creating this kind of material.
Are Shaurya?
Yes. So I think Dr. Swaminathan, you can continue. I think we will all have to create. I mean, these are online things, and if we have to cover 200 or 250 students, there is no other way other. I don't know any other way other than using some kind of automation. The paper-based thing takes a very long time, and the kind of the number of faculty we have. I mean, it is too much for with number of faculty we have. As Dr. Anshu has said, that we have to learn some certain things. Anybody else? Dr. Swaminathan, I think you can continue. Okay, Dr. Roshni Jacob.
Good evening, sir.
Yes.
Can you hear me?
Yes.
Yes, sir. I came to know about this the new curriculum that we are having more number of practical hours and less number of lecture hours. So these type of formative assessment can be done in during the practical hours, isn't it? You said that it is usually done after the working hours, but then can it be included during our practical hours? Hello?
Yes, Dr. Swaminathan.
Because in your institute we have decided in such a way that we can use these formative assessment, half of them soon after the lecture hours, after the class, and some of them we had kept for the practical hours so that it could be covered during the practical time. So is that feasible?
that is feasible also, but still that is first. It all depends how we strategize. Dr. Swaminathan, can you comment on that? I think Dr.
So, sir,
Swaminathan, I think there is some problem with the, his audio is, just a moment, let me call him.
okay, sir.
Just a moment.
Can I add to this here at the moment? What you're asking is how are we going to repeat the question again? The type of formative assessment. So what you can do with formative assessment is that, yeah, suppose I took a lecture. At the end of my lecture or between my lecture, I can have questions projected on my slide or like MCQs.
Yes, yes, yes,
And
yes.
I can, you
Yes.
can have your smartphone apps where you can ask them to click and you get the answers. So that is one way of getting us feedback about whether they've understood or not understood. Uh, it can be
Okay.
at the end of the class, you take 5 minutes and ask them a few questions, or you
But
can
then
ask them
how
to
do
go
you
home
assess?
and do it.
Yeah, excuse me, madam. How do we assess each student during the lecture hours?
The
Because
thing
you will
is,
be getting the.
yeah, you
It
don't
was
have to.
told in our because it was told in a previous learning that they just need to raise their hands to and say some of them will. And as we know, some students will be more attentive and they may stand up and answer, and the rest of them will remain like that. So how can you assess all of them apart from the method that you have said? So is there any other way you can do it during the lecture hours, after the lecture hours? Because with
Okay,
200 students, it will be,
as far
yeah.
as I understand, for the purpose of formative assessment is that you have to give them feedback. Everything need not be included in form of marks. So suppose you
Okay.
have a question somewhere and some student got it wrong. Even if you are giving the feedback to that one student, the feedback is going out to the whole class. So the purpose here is
Okay.
not to collect marks from everybody, but to ensure that everybody is understanding. Some places, like you have your university assessments, there you're taking the marks. But these basic feedbacks, formative feedbacks at the end of the unit, at the
Yes,
end of
yes,
the
yes, yes, yes,
systemic or maybe general pathology,
yes.
doing something, the purpose is to see that everybody is on board. So the more free the
Okay.
environment that you create, the better will your response will be. And one more thing, in the hours that are given for practical, use more of small group case based discussions.
Yes, yes,
So in
yes,
that,
yes, yes.
Yes.
are free,
Yeah.
they will
Because
be
we
able
have,
to.
okay, usually we divide them into 4. So
Yeah.
1/4 of the students will be coming for one practical hour. So we can have an interactive session, or what are the other methods can be used during the practical hours.
Okay.
But
One
then
method
another
which
question, ma'am.
yes, go ahead.
The thing is, this formative assessment marks will be included for the university, isn't it? Otherwise, I don't find
No, no.
interest students, because two things the students are keen is, one is getting attendance and the second is getting good marks in the university marks. These are the only things what we find here that the students are interested in. So if the attendance
Unfortunately,
is not given, they will start being attentive, or if the marks are included, then they will become attentive. Otherwise, these marks, whether it will produce an interest in the students, I'm slightly doubtful of.
okay,
I
two
mean,
things.
now what I understand that we have to move from marks to grades and grades to feedback. I mean, the concept of marks has to be phased out slowly.
Okay.
Sanjay, can I add something here? Anshu here.
Yes,
So
yes,
there are two things you can do when you have a huge group of students. Like if you have 200 and you want to divide them into groups, what you can do is teach
Yes.
your postgraduate students how to facilitate. Facilitation is different from teaching. Right? So the difference has to be made clear to postgraduates, that how you are getting people to speak and ensure that everybody is speaking. So that is one
Okay.
way of doing. And what we do usually is assessment is not in the form of marks. We have a sheet
Hmm.
where every student grades the other students of how much they contributed to each other's learning, whether they came prepared, whether they participated in the discussion. So even if you don't give
Okay.
marks,
Okay.
it is students receiving feedback from their own friends. It makes a difference. The second thing is students
Okay.
give feedback to teachers of each group discussion
Okay.
of how you did,
Ah,
and then teachers give
okay.
feedback to everybody. And all this can be either face to face, you can have it as a written thing, or anything. But even face to face works of being polite and knowing how to take out feedback. The second thing is, I don't
Okay.
agree with you that students are studying only for attendance or marks. Since the lockdown, I
Ah,
have sent out one email telling people to come online for a lecture. At 75% of the
yeah.
class has attended the online because they're interested. We presume they will
Okay.
not
Okay.
come. What they don't like is sitting in a lecture and getting bored. So if you make it more interactive, and if they find it useful for whatever purpose, whether it's neat or whether it's learning, they will come.
Ah, okay. Okay, ma'am.
Exactly.
So I
This is
think the
this is
whole thing will be
exactly
a
my
new experience
experience
for us.
also. Yes. I mean,
Yes, sir.
in
Thank you,
in
sir.
15 minutes of announcing the class, they all joined.
Okay.
Doctor, any more questions?
No more
Dr.
questions, sir.
Swaminathan, oh,
The other question was whether it was included in the university marks.
I had a question.
yes,
May I?
please.
I was
Yes.
like earlier we had like 2 terminals and at the most 1 sent up where we would keep 3 hours for theory, and so we would add the theory paper with the theory hours and the practical 5 hours or 6 hours with the theory with the practical hours. But now with so many internal assessments and more so in the so where do we put these hours? Like they have to be part of the teaching hours, but where do we put them? Will it not eat into the teaching? I mean, assessment is also a form of teaching, but won't it eat into the uh, so-called teaching hours?
Yes.
Your concern is genuine. Actually, we have raised this question in the Maharashtra University of Health Sciences, because you're talking about 2 internal assessment, but plus 1 prelims or setup or whatever you call it. So there are 3 exams, and the problem is these exams are not just patho, pharmac, micro, and forensic, but also medicine, gynec, surgery, and I think there's one of community medicine or forensic also in
Community
second year.
medicine also, yes.
So if you're going to have all of this together, you can be sure it will take 1 whole month,
Yes.
because students bunk before it, and then the whole exam and practical, by the time you put up the schedule, 15 days to 20
Yes.
days will go in each of these. So it's a genuine cause of concern that we were doing it in 1.5 years. Now you're saying 12 months, but practically it comes down to 10 or 11 months.
10
So
months.
Plus, ma'am, I have
something.
noticed this that
9
often
months.
students kind of stop coming to classes or a
Yes.
week or so, or
They
maybe
got
10
very
days
problem.
before, whatever, whenever an
This
exam is
happens.
scheduled.
So we've raised
So,
a concern at our university level. The please write to MCI and at least make it 2 internal assessments. 3 is too much. So we don't know what the university is doing at the moment. We've raised this question. So you can try with your own universities and find out.
Very valid question. सही है कैसे होगा इनका?
Yes. Any more questions?
No questions, sir.
I think
Yes,
we
sir.
so the points which Dr. Swaminathan has raised,
Yes.
many of them we will be discussing them along the way, and we will be applying them slowly and steadily. So So the various tools for formative assessment, which he has raised, that is some of them, the reflective writing, the self-assessments,
Yes.
the e-portfolios and DOPS and mini-secs. Many of these things, majority of us, we have to learn. And there is another problem that many of the new medical colleges, they don't have PGs, which
Yes.
and still the number is 150 or to 200 without PGs.
Yes.
That is another issue. Uh, so uh, so the point is there we have demonstrators, MBBS demonstrators, who keep on just sitting in the department and they are not involved. Quite often they are just sitting on one corner and preparing for some PG entrance, etc.
Yes. Yes, sir.
Now
Yes, sir.
the challenge is to involve them, make it interesting for them also, and bringing the whole
Really.
assessment process has to be re-looked at and reenacted and redone. And things, the learning objectives which are created, they have to be applied quite a lot, and students should be uh, made aware of the importance of the formative assessment. I mean, the main difference in this is that the amount of effort to be done on formative assessment is quite a lot. And
Yes.
Dr. Swaminathan, he has talked about the simulator-based assessment, some e-learning, and he also has talked about Kahoot online platform, which we can download on our mobile phones. Maybe we can have one session on only Kahoot. In some colleges, I have seen Kahoot is basically a class-based quiz, which is it is a game which using their mobile phones the students can use, and it is a very practical and easy platform, and many colleges are I mean, I have seen they have started using, especially where it all depends upon the skill of the uh, yes, 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 I okay. uh, so then he has uh, there is an issue that no single tool to contribute more than 25% of total marks. How to implement that? Uh, that is another challenge. Any comments, anyone, on this?
Basically,
If
it
I may
means
say
that
so, I think, sorry, please go ahead.
basically it means that you have to use you have to use multiple methods. So if you're saying use only MCQs or only long questions or only practicals, so each of them are testing different competencies or different attributes. So it simply means that you have to use a whole cafeteria
Multiple.
choice and use different methods.
I think it is not too much of a problem, because like in our college, apart from the main practical exam, though we are taking their marks, but we do conduct tutorials, we do conduct seminars. So it's just that we have to mark those things and then finally add those marks. So that record has to be maintained for everything. But I think even now people are, I mean, most of us are holding case-based discussions, tutorials, seminars,
Yes. Yes.
apart from the typical practicals. So I think in any case that makes up 4 modalities as it is. So
Okay. and no single assessment to contribute more than 25% of total marks. So quite often we used to give a lot of marks to the send-ups, but that has also changed now.
Does that mean that the university exam will now contribute no more than 25%?
No, universities is different.
Yeah,
The
this is
internal assessments, they have to be widely spread out.
Yeah, this is based on the concept of programmatic assessment, where it doesn't mean that students study only for 1 month. So you're seeing the performance throughout the year, how they are doing.
Okay.
Actually, there is some problem with the Dr. Swaminathan's audio, so I am speaking on his behalf. He has sent me his presentation. Also, he has pointed out that the internal assessment plan of a theory 50 marks, practical 50 marks, and the various kinds of questions, and there are also marks for preparation, participation, regularity, involvement, 8 marks, 40 marks for short knowledge tests, short answer questions, very short answer questions, MCQs, and also for 2 marks for other academic activities, that is quiz, seminar, etc. And there are marks for attitude and communication skills, that is the use of multiple tools. We have to use multiple tools, 35 marks. The regularity, professionalism, and presentation carry 8 marks. Log books carry 5 marks. And the various ICMR projects and community work also carries 2 marks. So this is another difference.
Every university, every institute can have its own spread of marks, and at MUHS we have decided one thing. So your university, if you're on the board of studies, so you can contribute and decide what to do.
So, ma'am, have you decided a uniform distribution of marks for all the departments, or has each department put up its own set of distribution for the theory and practical?
Each department is different in MUHS. I don't know about other places.
Thank you,
ma'am. Yes, in our university also each department is different. So then there is a quarter model. The results are declared within 2 weeks, and providing feedback is mandatory. There has to be group feedback and one-to-one feedback. And there is a weightage of marks for attendance, academic activity, reflections, logbooks, assignments, etc. So we will, as we go along, we will, I think chapter wise, we will have to create some strategies. How to, I mean, this chapter on cell injury may be taught in a different manner. The chapter on cardiovascular will maybe different manner, neoplasia slightly different. The assessment strategies we have to jointly work out. Everything may not be apply everywhere, but some broad consensus we have to work out. Any more comments, anyone?
How are we, has anybody thought about assessing attitude and how that can be done in pathology? Because there's not much of clinical interaction as such. And once they know that there's a certain thing they are looking for, that they will do so in that situation.
Now in ATCOM, they have given this thing, no? Case discussion.
Yes, there are some ATCOM modules for second prop also. And but
Our
even I
AdCom
mean,
model is discussed in other places, because in MHS they have divided each of the AdCom assignments, like one department will do four of those, and pathology will do two. So it's divided like that. So we have got teamwork.
Yes.
So teamwork we are teaching in terms of blood bank. How will you do things in the blood bank as a team? So that's how we are teaching it. The plan is as such like that. How are other places doing it?
Excuse me, sir.
yes.
Before the next session, is there any homework that we need to do before your next webinar? Because since we are straight going to the chapter-wise discussions, is there any?
They are coming. I mean, we were planning that first we should discuss certain general topics. The chapter-wise things are going are about 2 weeks away. In the coming I mean, before going to chapter-wise, we need to know what are competencies, what are learning objectives, what is some case-based learning. So some general topics we are going to discuss in the coming 2 weeks. And after that we go for chapter wise, but still we have already started collecting of chapter wise collection of resources, so that everyone remains busy, and also these resources can be shared, and they are reaching to you on your email. I have created an email group also, and they are I mean large, I mean huge fantastic collection is already there on your email. If you see,
Okay.
we can
So is it chapter wise resources
no,
that is coming?
at present it is not chapter wise, but gradually we will be adding, I mean they are sort of general, but at present they are not chapter wise. We will be along the way, when we discuss the various competencies as per the MCI booklet chapter wise, then we will be maybe compiling them from these resources. I mean, besides our own.
Can I ask one more question?
Yes, sure.
That is regarding the marks that we put for, it was actually asked earlier about the attitude, professionalism of the students. How do we assess them, and wouldn't they become rather subjective when we put marks?
Anshu, can you answer that?
It is not done in the form of marks. It is when you observe them how they are functioning in the field. So if we are getting them to do some task, and then your observation is given, it's usually in the form of checklists, and feedback is given on specific ways in which they function. Even if you're saying you're taking a group discussion, so in the group discussion, are they respecting other people when they talk? Are they actually coming prepared? Are they being punctual? So these are all ways of instilling professionalism at that stage in the second year level. You can do that.
Okay, so we need to have a checklist with us to see whether all these has to be included in a checklist. Is that so?
Where you're going to look at what,
Okay.
and if suppose they are giving them group projects. So in the group projects, you can take feedback from the whole group about how much who contributed and how it was to function. So it did not be in the form of marks, but even giving each other feedback will tell them how they have performed as a professional. So that also makes a difference. We've added a little things like communication skills, like suppose there's a blood donor who has come. How will you convince that person to donate blood? Or if you have somebody with a report of diabetes, so how will you interpret the report, and how will you tell the person the report? So things like that, you have to be a little creative. Don't go by the book. Think of what a person can do. Like if somebody has come to for an FNAC, how do you speak to that person? How do you get a consent from the person? So things like that.
So during,
Somebody's come for
so it is,
acupuncture. Yeah.
So I find that it is going to be very different from what we have the practicals nowadays. It is going to
You
be a
have
very
to be
different one.
very creative. In fact, at
Yes.
MUHS, we have removed all the old things where they had to do urine examination and they had to do hemoglobin by Salis. So all the backlog has been removed, and we are just talking about interpretation. What does an MBBS person need to know? Does he really have to go and do
Okay.
Benedict's test? No. So at the most, we are teaching them what to do with dipsticks. But when the interpretation comes, he's given a report of nephrotic, and then he's asked to say what is the questions are all related. So we're trying to make it
Okay.
more linked to clinical, more applied the way Robbins puts it. So that is what that at our university level is. So you can try what you want to do.
Okay.
Remove all outdated things. This is the first chance and last chance that you have to remove it. So put in the new ones.
So, okay, ma'am, because we now have these urine tests now. So is it
Yeah,
that
our
next year
university level
we
you have
won't
to
be
come.
having them? We have all
You
the
have to
Benedict's
discover.
test.
The MCI doesn't say
All this.
anything. You have to go at your board of studies level and then fight it out there. So we have done that. So
Oh,
do it
okay.
with your board of studies
Oh,
or whoever is going there.
okay. Okay. Thank you, ma'am. Thank you.
Good evening, madam.
Very informative.
My
Yes.
hello, sir. Is it the logbook and the practical books are the same, or you mean to say they are different in CBME new curriculum, sir?
Different.
Logbooks are very different from practical books.
Different.
Yes, sir. But why this logbook has come in here in the CBME program when we are assessing at grading is being taken up at various level after the each classes and each small group discussions? Why this logbook has come here then?
Logbook is basically a record of what the person has done throughout the year. And it may not be only the practical, but there are many other things.
The present
I mean,
logbooks also have them to write reflections of what you saw, what you learned. All of that is there. And the logbooks also have certifications. So if the person has done venipuncture 4 times, each teacher has to sign there and say they've observed them doing that technique or whatever. Or they made the peripheral smear in front of me, and then the sign has
That
to be
means
there.
when you said in your practical this thing more of interpretation rather than perform what they have to perform. But the practical book also they have to write the same thing. And then what is the difference between a logbook and the practical book then in practical hours?
That's what I said. You don't have to get them to write the same thing like you used to do before and get our seniors or juniors to write our journals. We don't have to do that. You have to get
Yes.
it certified from the teacher who has observed you doing something. So if a peripheral smear
Okay.
has been made, you have to observe it and sign that the person has done.
Okay. Okay.
Ma'am, I feel I'm not sure that probably the practical book is no longer relevant. It is more or less obsolete now. Or is it? Because why would they write the process and all of
It is
things?
not it's up to
Madam,
you
till
to
now,
decide. Every university has given different things. Like if you have asked them to do a DLC, and if they have done the practical, they can write that practical part there. If they have done something, or an interpretation of a case has been there, it need not be what you used to do before, like write slides and draw diagrams.
What we are
You
writing
can do
nowadays, the
that.
process and all, I think that part at the most, the typically the calculation, the result and the interpretation, maybe.
Yeah,
That.
so
yes.
did not write
Not
it
the holistic long notes that we used to give, that we give even now. That
Yes, actually, at many places I have seen that they have got printed. All these things are pre-printed, and you
yes, sir.
students just have to make a diagram on one side, maybe fill in the blanks.
All the
And
yes, ma'am.
I saw some workbooks in some medical students in some other countries. There they are given a work. They don't call it practical book. They call it workbook. And in that workbook, they have got certain cases also printed. And below those cases, there are some references also. Read this from this book. And then there's a blank page, and in that they have to write some reflection. And I mean, so it is a combination of a logbook and a practical book. They call it a workbook. So those concepts are also there.
A step just away from the portfolio. So when you say portfolio, you have to write everything and have a proper collection of that, similar to that, but one step behind that.
Yes.
Yes, yes.
So any more questions? Dr. Shashikala. Uh, Ma'am, you will have to unmute yourself. Okay, anybody else? Dr. Rajshri
Yes,
Ingen.
sir. Yes, sir. I was just going
Yes.
through the CBME competency workbook today. There are around 20 DOAP sessions. Hello, can
Okay.
you hear me, sir?
Yes.
There are 20 DOAP sessions in the CBME pathology.
20.
20 DOAP sessions.
Yes, directly observed.
Yeah. Demonstration, observation, and performance,
Yes.
assistant performance. Should all that be recorded in the record book? And I mean, now the record book would be totally replaced by the logbook, or the students can still maintain a record book for those DAP sessions and then have a logbook for these formative assessments or whatever.
Both of this is going to be combined.
Combined into a single book, single record or a logbook.
Yes.
Hello.
Yes. Yes, I think we can combine them into a logbook or.
So like previously when we had record book, they were just saying today to do a DOAP sessions for some inflammation, some on amyloidosis and things like this, which we were already doing in the practicals, like showing them the gross and the microscopy and asking them to do it in the record book. So will that be still continued to be recorded in the logbook, or no, that needs to be, because we don't have still clear ideas from our university, like how we are going further with this DAP sessions or practicals, how we need to conduct the practical exams for the university exams.
I think these things are slightly flexible, but exact instructions are not there. But I mean, the objective of both these is that some record of has to be kept of what the student did, because anything which gets recorded properly gets done.
Yes, sir.
So maybe how we are going to do it, at present I think it is slightly more flexible. I myself not very clear.
Okay, sir.
Anshu, what's your take?
Gone through that logbook instructions yet, but at our university levels, they had in the logbook there is a chart where they are given marks for attendance, they are given marks for punctuality and attendance, and participation in the group discussions. They have given marks for the kind of reflections that people have written. The 20 marks for the logbooks we have divided into, because 20 is a big number, into how they have performed throughout the year. So we are not going into the old thing of how kitna acha diagram banaya or what they have written in the books, but basically what they have done throughout the year. So that record is there. So the teacher can give marks about how they performed in the group in that logbook. And totally you can combine the marks and give it as the marks for logbook.
Okay. Dr. Malini?
Yeah. Can you hear me?
Yes.
Yeah. Just wanted to just on a philosophical note, because I actually seems as a lot of uncertainty about a lot of things. So we are moving together as a group so that we're able to solve a lot of uncertainties. But I was just on a different note. I was just thinking, why did we actually move into something like this? Because all of us have not studied with this method, and I think we all turned out pretty fine. So what is this the real motive behind moving into a phase like this? Was it for the new generation, which is more tech savvy? Is it tailored for them? Was there a particular motive for moving into a CBME kind of assessment or CBME kind of program?
Uh,
Just as a thought, I was just.
I think the.
So may
Yes,
I
please.
give my thoughts on the topic? I feel so,
Yes.
ma'am, in the beginning when we were learning practical skills, the teachers were much stricter, and we were forced to learn a good amount of theory. And then in the internship, we learned the practical skills really well, because we would do all our postings, and including the clinical postings during the MBBS years. So that would be enforced quite strictly. As the number of teachers, I think, dwindled, number of teacher-student ratio dwindled, plus with the advent of these pre-PG entrance exam and earlier, I feel people were also content to be MBBS. They would get patients if they had a good clinical acumen. Now that is almost, I mean, anybody who doesn't have some kind of specialization doesn't really get patients. And so there is that huge craze for to get a degree, a diploma or something. And they are no longer bothered about learning the clinical skills. That emphasis is not there in our system. And plus the teacher-student ratio has also dwindled a lot. So though whatever little bit we learned, I mean, we learned a decent amount during our MBBS years, and we learned a great deal during our internship years. Well, we were even doing labor and all, delivering babies at that stage, living in sutures. Now because that has gone completely. They hardly know anything of practical aspect. They know hardly anything of clinical aspect. And I think with the advent of private colleges also, almost anybody gets an entry, and if he's reasonably decent, and that person is not really motivated enough. Neither are the exams so stringent. So there has to be some way to refashion it. That is what I feel. Just to make the clinical part compulsory, the practical part compulsory, and maybe that is a thought behind the next program also. I feel. I mean, I'm not
relieving God.
I don't.
I agree with you to a very long extent. Now I'm showing you what I feel. In front of me, there is a website called wfme.org, and this shows this is accreditation, and it has got ECFMG eligibility for medical graduates. ECFMG has announced that effective 2023, eligibility for USMLE and employment as doctor in the United States will be restricted to graduates from medical schools accredited by an agency which is recognized by World Federation of Medical Education Recognition Program. Now, if we click here, the accreditation, so they have got an accreditation requirement, and now the process is now this document has been there for almost 10 years now.
Okay.
And so by 2019, a lot of training has happened. The thought process is that India should provide, I mean, they are the world, I mean, But I feel that on the top level, they feel the whole world must have the similar system of medical education, which is also there in the West and also in India. And there have been many changes. If you see in those of you who have traveled to Middle East or some other countries, the whole systems everywhere has changed, except India.
Yes, yeah.
Can you mute yourself? So, and India is quite late in changing because there's a deadline of 2023 and 2019 batch will complete in 2023. If we delay any more, one batch will be there which will not be at par with the rest of the world. I mean, so-called USMLE, but what they are planning that the large population of India, it should be trained as per the system as is there in the rest of the world. And India should be, I have even heard some people saying India will provide doctors the health factory for rest of the world. 500, I mean, you see, in India, the number of medical colleges is increasing. In the rest of the world, especially developed world, it is decreasing. Some countries have got more PG seats than UG seats, and most of those PG seats are filled by Indians. The burgeoning population must be trained, and I mean, the global healthcare factory is India. So this is one, and the kind of mess in which we are currently in the medical education, some change has to be there. There will be problems, there will be teething problems, there will be this change management problems, there will be skepticism, there will be many people will beat us black and blue, and we will all have to pass through those phases. Every change passes through certain phases. There is going to be opposition, there is going to be violent opposition, and after that there is acceptance.
Yeah, yes.
So be ready for some lot of sparks everywhere.
Thank you, sir. So time will tell, I guess.
Yes, we are all in the same boat.
Yeah.
Because we've actually crunched up everything. So every single thing seems to be crunched into minimalist hours. So somehow I feel that the basics are not happening. So
yes, I mean,
so that was something that we used to
and
pride ourselves on.
Yes, maximum efficiencies must come. The silos must break.
Silos.
Yes.
Sorry.
Any last comments, Anshu?
Thank you for all this. And if you want a copy of this water model, which Dr. Tejendra and I have written, I think Sanjay can share this article with everybody. The internal assessment article.
Sure.
You have it, or
Yes.
should I send it to you? Okay.
I'll have to search for it. I have got a lot of articles and I have to search. Please send.
No. If you just Google water model and Indian pediatrics, you will get it. It's Dr. Tejendra and I have written this article on the water model.
Okay.
Yeah, you'll find it.
So we want logbook and DOAP.
Yes. Is there any logbook for ready for pathology anywhere?
Actually, Sanjay, have you shared the document on logbook from MCI with everybody?
Yes, I have shared. Yes, I have shared. I have shared that.
We have made one, but it is not yet approved by MHS, so I can't give it to you. So
okay. So we will go through that document together also.
Yeah.
Okay.
It's not going to be very difficult with the logbook.
Could you please send?
Yes.
Sir, could you please send the soft copy of the CBME of pathology, because even the one that I have, there are no certifiable
skills.
What should I say, skills. So maybe then I would like to get the
There in the
updated version, or
it's there in the table itself. There are just 3, and if you look at the table, you will find it there certifiable.
So logbook and 20 DOAP.
Yes.
One question to Anshu Madam, sir.
Yes.
Actually, sir, how Madam is planning for practical assessment or routine practicals regarding the clinical skills, everything what Madam has planned as a just a, it depends upon the CBME program and ICMR projects in community works. That means how many should take, or is it necessary mandatory for all the students to go for ICME that project community works?
Community work can be done in blood bank.
Yes, madam. But ICME programs, you have to give one project report so that the ICMR has to sanction that project report, saying that they should specify 50 patients or 50 cases or like that. So we have to
As
make
far
a
as
project
I
on that.
understand, as far as I understand, it is for those meritorious students who have undertaken
Yes,
undergraduate research, and if
but it
any
is
of them
not
is in
for.
pathology, we'll give them 2 marks extra. So, and this
Oh,
is for every
oh,
subject. So if they've done the project
okay,
in microbiology, the microbiology people give them 2 marks, not we. So it's like that.
okay. It's not a mandatory, right, madam, for all
No, it's
students.
not
Okay.
mandatory.
Elective.
It's extra
No,
marks.
Yes,
it's
it's
not
Yeah,
only
mandatory.
2 marks.
yeah.
Madam, I last question from me. How we are planning for your practicals, madam?
We are
Can
doing
you share your
OSPE. We are
OSPE?
doing,
Okay,
we have asked for OSPE.
How
There's a huge resistance going on to OSPE now because most people
okay,
don't know what OSPE is, but we are trying to convince them and actually teach people how to do OSPE because they're so used to spotting that to get something else is a little difficult. But we're
Yes.
shifting to OSPE from spotting.
yes, yes. To
We'll tell
change
you
the
the
Yes.
difference.
We are planning one webinar only on OSPE
OSPE.
along the way. So I think it's quite late now, and more than 1 hour and 40 minutes have passed. So I think we can end it now. Yes.
Good night. Thank
Tomorrow. Yes.
Thank you, sir.
Tomorrow we have got, I have got 2 free webinars if in case you are interested. One is on the
LMS.
at 10:30 on COVID, the coronavirus by Dr. Sanjeev at 10:30 in the morning, the
Even
public health
9:30.
aspects of coronavirus, and
Sir,
also
even
at 3 by Dr. Manjulika. That is on, she has made the whole medical college, Lady Harding Medical College, she has taken online during this coronavirus days, and her experience with the Schoology app, she will be presenting at 3. So in case anybody is interested, you can, there are special teaching strategies so related to coronavirus days, our lockdown days. So
yes, sir.
so we'll be keeping you busy tomorrow morning.
Thank you, sir. Thank you,
Okay.
sir.
Thank
Good
you,
night.
sir. Good night.
Good night. There are on chat, there is, can you share the link for the webinar? Yes, I will share, and please elaborate on online quiz. Okay, that also we have already done one, but on using Google Forms, and we will send it again. Okay, good night.